thanks for being willing to be interviewed on the topic of abortion.
Very welcome.
So we're on the 4th anniversary of the adoption of the abortion law in Queensland. So in the 4 years, how have you viewed the implementation process?
Well, it's been so positive that after 120 odd years of abortion being a crime in Queensland, 4 years ago was a wonderful revolution, if you like, to bring us into the 21st century and say that abortion is healthcare, and that of course it's not a crime for a woman to make decisions about her own body and her own future. So it was just a fantastic moment. Many, many decades in the making, lots of amazing advocates brought us to that moment. So that was a really positive change. But unfortunately, in the 4 years since that, we've seen that whilst the legal issues have been resolved, the access issues have not. And we're hearing more and more stories from women who are saying, I know that it's legal, but I thought it would be easier to access an abortion, and I can't afford $800 or to have to travel from my home if I live in the regions to try to get help down in Brisbane. So the legals were a necessary hurdle to be addressed, but access and affordability are real barriers in the way to women having proper access to reproductive health services.
Do you see that as the main challenge?
Very much so. I think previously the legal situation made doctors a little bit nervous about providing that service. Now that hurdle's been removed, but it's still a real issue of financial barriers. There are still limited numbers of doctors that are authorised to prescribe for medical abortions, and there are still limited places where you can go for a surgical abortion if you're a bit further along with your pregnancy. So there are still real limitations on the healthcare that's available to people, and unfortunately it's still really expensive. So what I would like to see, because I work in the federal realm as a Senator for Queensland in the National Parliament, what I would like to see is the Commonwealth Government do a lot more to help states provide healthcare for people no matter where they live. The states certainly regulate abortion as a legal issue, but in terms of the funding, the federal government could and should be putting in more money to make sure that public hospitals, for example, provide abortion services, or that more GPs are accredited to prescribe the abortion pill, and that people don't have enormous out-of-pocket fees when they seek this healthcare. Even with a medical abortion, you need to have your GP appointment, you need to then pay for the medication, you need to then have a follow-up GP appointment. The costs mount and mount, and that's if you can get into a GP that bulk bills. So we're looking at hundreds of dollars for a medical abortion, and definitely hundreds, if not more, for a surgical abortion, plus travel costs. People just don't have that sort of money lying around, and we think the Commonwealth should be recognising that this is a healthcare service. We have Medicare. Medicare should include full reproductive rights, and we should make sure that people can get the healthcare they need when they need it.
So there's two challenges. There's a financial challenge and there's the ease of being able to implement the actual process of abortion. And do you think that's a thing that's is solvable in a short term if the funds were there?
Look, what we've seen in the last little while is the private provision of surgical abortion close on the East Coast. There used to be some private clinics where you could have a termination. Again, it was costly, but at least they were there. They unfortunately closed due to lack of funding, and so now the problem's become even worse. And so an injection of money from the Commonwealth could be a very ready solution, and I think it could be quite a quick solution as well. So the things that we would like to see for the Commonwealth to do is to list abortion as a Medicare item, so that when you go to your GP, when you're accessing the abortion pill, when you're doing your follow-up checks, you can claim that on Medicare. You don't have a gap fee, you don't have out-of-pocket expenses. We'd also like to see public hospitals who receive federal funding be required to provide the full range of reproductive health services, effectively as a condition of receiving that Commonwealth funding. That was Labor Party policy back in 2019, and it's good policy. Unfortunately, they walked away from that. We would like to see the Labor Party re-adopt that as policy, because we think that will make sure that people, no matter where they live, can go to their public hospital and get the full range of reproductive health services. So I think those fixes could be quite quick. The question is whether there's a political will to do those fixes.
And in terms of your campaigning or your activism towards that. What are you seeing happen in that space?
Well, this is an issue I feel very strongly about because women everywhere are coming to me saying, we thought this was fixed now that the laws have made it not a crime anymore, but I can't afford to get the healthcare I need. Or, I had to borrow money from my family or my friends in order to get a termination in time. So this is definitely fixable, and what I've pushed for and so far have been successful on is setting up a Senate inquiry to look at abortion access and the barriers that people are finding to proper healthcare access. And the objective of that inquiry is to gather some evidence about just how dire the situation is, particularly in the regions. We're finding rural and regional women are saying, I just don't have anywhere to go locally. I've got to pay to get myself to Brisbane to get healthcare, which is insane in a country like Australia. So we're using this Senate inquiry as an opportunity to gather the evidence, and we're hoping that it can then produce a report that's very persuasive, that pressures the government in the lead up to the next federal budget to take some action on these issues. And I've had some really good preliminary meetings with the Health Assistant Women's Health Minister, Jen Carney, and I know she's committed to this at a personal level as well. So I remain optimistic as always that we can get some positive change, but we're going to need as many people as possible to engage in that inquiry to really give us the evidence base to persuade the government that this is something the Commonwealth should do more on.
And in an optimum world, shall we say, what's your vision in terms of time frame and what you want to achieve?
Well, the Senate inquiry submissions close, in fact, a few days ago, mid-December, and we're hoping to have hearings right around the country in in January, February, March, with a report April, May. I would hope that the next federal budget, which is of course in May, the government decides to do something about this issue. They may or may not. If they don't, we'll keep the pressure up for the subsequent budget. But I think in this term of government, we need to really make sure that women can access the healthcare they need, including abortion termination services when they need them. And I would hope that that's something that we can achieve in this term.
And what can someone like myself and the general public, women, how can we help?
Such a great question. We really need to let politicians know that this is an issue that's important to people. This is an issue that's a real problem and that needs to be fixed, and that there's ways that the Commonwealth could fix it and that they should do so. So I would suggest that you and anyone else who feels passionately about access to healthcare for women, and for everyone for that matter, writes to their local MP and says, what are you doing about this issue? The Commonwealth should do something here. Let's make abortion accessible and affordable, not just legal. So I hope that that public pressure will help build to force the government to do the right thing. In theory, that's how it's meant to work. A little bit of media attention doesn't hurt either. Unfortunately, governments tend to be motivated by headlines. So we're working with people in the media to give this issue good attention. We've had some great interest so far. So we're sort of trying to get the ingredients here for a good policy outcome that helps people.
Mm. Well, I'm going to be writing after this, Larissa.
Wonderful, Patricia. I look forward to that.
In terms of the allocated budget, do you think what you're asking for is enough to address the issues at the moment?
So there's really two potential solutions to making abortion more affordable and accessible. Firstly, it's to make a Medicare item for abortion so that when people go to their GP to get the abortion pill, they don't have those out-of-pocket costs. Now, that's relatively costly, but a stitch in time saves nine, as always. So that's the first budgetary ask that we have. The second budgetary ask is for public hospitals to be properly resourced to be able to provide abortion services and maternity services for that matter, the full range of reproductive health services for women right across the country. Now again, that one's costly, and there's also a complicated agreement between the Commonwealth and the states about who funds hospitals. But I think really Australians expect and deserve a healthcare system that meets their needs. That's why we pay taxes. And if governments want to bicker amongst themselves and point the finger at the other level of government, that never goes down well. People just want the problem fixed. They just want the services that they should be entitled to in a nation like ours. As I said, that's why people pay tax, and that's, I think, the least that people can expect of their government is the provision of healthcare services and education services, for that matter, to a standard that meets their need. So it will cost a little bit, And we've got the Parliamentary Budget Office doing the figures for us at the moment to work out precisely how much that would cost. But women are worth it.
Well, there's no future without us.
That's right, that's right. And keeping women healthy and empowering us to make choices over our own bodies and our own future, that's something that a good government in the 21st century should do.
Larissa, the Greens Party in the Senate asked for better and more access to state facility and services for abortion. Can you tell me about where you're at in terms of this request?
Well, look, it's a work in progress. We're hearing the evidence that people can't access abortion affordably or locally, and that needs to be fixed. And the Commonwealth needs to take responsibility, work with the states, provide the dollars to make sure that people can go see a GP affordably, get the abortion pill if they're nice and early in their pregnancy, or if they're post 9 weeks, get a surgical abortion. Again, be able to go to their local hospital, not have to drive 800 kilometres or somehow pay for a flight to get to a main metro centre, be able to get the healthcare that they need. So this is a work in progress. We've got a Senate inquiry set up to look at the barriers to access for abortion for people. Are they worse in rural and regional areas? We know they are. This will be an evidence gathering exercise so we can say to the government, this is a real problem here. You've got some levers that you could pull to fix this. People expect you to fix this. They deserve this to be fixed. Over to you.
And is there anything else that you want to add that we haven't covered?
Oh, look, I might just add abortion is a real postcode lottery. If you're in a metro centre, you've got better access, but it's still costly. If you're in a rural and regional area, it's really pot luck as to whether you'll have a local GP that's accredited to prescribe the abortion pill, and your local hospital may or may not provide those services for you. Now, that's just totally unacceptable in a wealthy nation like Australia with a Medicare system that we all contribute to providing. So there's a lot that should be done to make sure that there's not a tax being paid, a health tax, if you like, for living regionally that's disproportionately borne by women.
It's true. I was just thinking a lot of my family came from out west, and I'm thinking, you know, that's very true, because they have to travel, and I just was looking at the map out there, and I'm going, Queensland is so huge, like the people up in the Gulf, what happens to women up there?
And what if they've got other kids? Who's going to look after the kids while they need to drive somewhere to get healthcare? Like, it's a major logistical exercise, and you've only got a short window before you can't have a medical abortion anymore. It's got to be surgical, and again, there's a window there. We need to be making it as easy and accessible as possible for women to make those decisions and not putting barriers in the way. I mean, free contraception is another great solution to try to prevent unwanted pregnancies in the first place. There's a lot that can be done in this space, again, that the Commonwealth should be doing, and the inquiry will look at the full range of that. Availability of information about contraceptives, particularly long-acting reversible contraceptives, how much they cost. So we're really going to try to do a broad sweep in this inquiry and look at what are the barriers along the way and how can we address this. That's the job of government to fix these barriers.
Yeah, so it's a big job. Larissa, it's been lovely talking to you, and thank you for your time. And I'm gunning for change. You're gunning for change. So this is kind of like a shout out to all women out there. What would you like to say?
Well, thanks so much for your interest in this issue, Patricia. It feels like we're really at a moment in time where we can finally make abortion affordable and accessible. We've solved the legal problem thanks to the work of so many for so many years. But women are sick of being treated like second-class citizens. We're still fighting for gender equality. We're still fighting for access to healthcare. We're still fighting for safety at home and in the workplace. And we are fed up with not having the things that we need and deserve. So this Senate inquiry will be a great opportunity for women to share their stories, whether they're experts, doctors, health practitioners, or punters who've tried to seek healthcare and been locked out of the system. We will keep the pressure on for the government to stand up and deliver for women, including on reproductive healthcare options.
Thank you, Larissa.
You're welcome. Thanks for your time.